low numbers that have been collected during the year because of COVID-19 restrictions, of course. Usually, blood services throughout the country were able to collect donations from schools, factories, and various businesses. But this year, blood services solely had to rely on citizens coming into blood banks or donating at selected malls. This has proven to be a hard task, as many people fear donating blood with coronavirus still out there. For more on this, we're joined by the South African National Blood Services Chief Operations Officer, Ravi Reddy. Ravi, welcome to SA Today. Thank you indeed for joining us. I think the question I would have asked first was, how dire is the situation? But I know year in and year out how dire the situation is for blood in South Africa, in particular at this time of the year with accidents. And this year, I'm sure it's even worse.
Yes, good afternoon, Tabisa, and thank you so much to SABC for having us on the show. The situation this week is quite dire. We need to have a 5-day stock of Group O blood. Group O blood is blood that we can give to people in an emergency as well. So with 5 days of stock, we can adequately cover the country and especially the rural areas. This morning, we were sitting at 2.5 days stock, so half the supply, with the probability of it reducing because of the holiday that's coming up this weekend. So when we are at 2 or 2.5 days stock, there's a real possibility that we have stockouts at hospitals. And, you know, that is dire for patients if they are in that hospital.
Now let's talk about the aid that, for example, SA Blood Services are helping with the fight against COVID-19. SANBS earlier this year, I know, embarked on a study using plasma from recovered COVID-19 patients as a potential therapy. How far are we with that study, and how has the uptake been like so far anyway?
Yes, South Africa is currently, the blood services are currently performing a clinical trial together with a number of clinicians. We've enrolled just under 80 patients that have received the convalescent plasma. We will not know the results until we've enrolled a full number, and we actually then do the analysis. So we expect early in the first quarter of next year that we will complete enrolling the required number of patients. Then we can analyze the data. So we've enrolled patients with convalescent plasma and patients without. Once we analyze the data, we will be able to see if there's been a positive impact of convalescent plasma on patients that have received it compared to the placebo group. So that will only happen next year. There's a number of trials that are also going on globally with convalescent plasma, and a lot of those trials will yield results in the new year as well.
And on the flip side as well, the danger of the virus that has had on South Africa, as I mentioned in the intro, with regards to your operations, collecting blood, which is what you do from donors, COVID-19, I'm sure a lot of people, like I've said, have been saying, oh, maybe it's not time to be walking in and out, to go to blood banks, to give blood. You yourself had to take extra precautions, I'm sure, because you can't just have a Tabisa walk in. You don't know whether he's been asymptomatic or not. You don't know whether he's had a blood, a COVID-19 test. He doesn't just walk in and give blood, because that blood must be used by somebody else. How have you gone around or got around that situation?
Okay, since March this year, in fact, quite early in March, when we noticed the pandemic in Europe and America, we implemented stringent infection prevention control measures. We started already doing social distancing at our clinics. So we have a screening process when a donor comes in, where we screen them on their health. We take temperatures. Once they're into the clinic, there's social distancing protocols observed, sanitizing of beds and all equipment after a donor comes in, and a lot of contact tracing if there's a potential positive or we get a report back. So any donor who has had symptoms is deferred for 28 days. And, we ask them only if they're leading a low-risk lifestyle and no symptoms to present. But you are quite correct. There could be people that are asymptomatic and not aware. And if these individuals come and donate and then a day or two later realize that they might be becoming symptomatic, to please contact the blood service, so that firstly we can remove that unit of blood from the supply, but we can also, all staff and other donors that potentially came into contact, we can contact them. So we run a very stringent operation, because obviously the safety of our staff and our donors is top priority.
Speaking about that, just out of curiosity, I mean, if let's say we do get person Tabisa Kamini donated blood, although I know last time I donated I was in high school, scared of needles, but that's another story. Tabiso comes in, donates blood, and then you find that I was asymptomatic. I possibly don't report back to you when the symptoms come through, or maybe the symptoms don't get me as hard as they would have gotten anyone else. I think it's a mild flu. What happens to the recipient, for example, of the blood? Is COVID-19 transmittable through blood donations, for example?
Okay, so to date, extensive research has been conducted exactly on that, whether if COVID-19 virus is in blood and can it be transmitted to patients. There is no scientific data that actually shows that COVID-19 can be transmitted from a donor to a patient via blood transfusion. So we haven't seen anything in this last 9 or 10 months that indicates that that could happen. And there's been extensive research, particularly by colleagues overseas.
We're running out of time. Quickly, an appeal once again, and I know that it's an appeal that you make every year because of the need for blood, in particular for South African roads with all the accidents. You said we've only got 2.5 days left in the cabinets. An appeal, final appeal to South Africans. How do they go about, if there's a way they can get out there and give blood, how do they go about it, and what can they do for you?
No, thank you. This year is extremely different. You know, every year during Christmas, we know we'll be short of blood, but the hospitals are not that severely constrained. This year, our frontline staff, as you've been quite rightly saying, and everyone's saying, is under huge pressure. And the last thing we can have is adding more pressure where there's no blood and people are running around. So I'm appealing to the public, our donors, people who are listening to the show that might have not donated blood previously, particularly if you're group O or B, to please go into one of our donor centers, or we're located at most of the shopping malls currently, and please donate blood so that we can ease the pressure further on the already heavily constrained healthcare system. Thank you.
Thank you very much. South African Blood Services Chief Operations Officer, Mr. Ravi Reddy. Thank you very much for speaking to us, sir, and good luck to you. Please.
Thank you very much.